Without specific and measurable goals in therapy, the entire process of therapy can become inefficient and directionless. The therapist does not set the goal for the session, but the therapist and client collaboratively negotiate and agree upon specific goals for the client. Let us look at some broad goals for therapy. The basic goals for therapy are: number one, reduction of emotional upset and dysfunctional behaviors and symptom reduction. The second important goal for therapy is skills learning. Sometimes, with long-standing illnesses, patients and clients may have skill deficits. For instance, they may be lacking the skills of problem solving, crisis management, assertiveness, time management, and so on. The third important goal of therapy is to offer support to the client. Also, to build their resources. This is important as building resources makes the client more independent and less dependent on the therapist. Another important goal for therapy is to assist the patients or clients in solving practical problems. They also need some assistance in making decisions. However, the therapist does not provide a ready-made solution to the problem nor takes ready-made decisions for the client. One of the last and important goals of therapy is to prevent a relapse and manage a relapse just in case there is one. Clients will typically narrate their practical problems, for instance, having been exposed to the virus, or a patient having been quarantined at home, too much of work, boredom, drug or addictive substance withdrawal, etc. Your role at this stage is to help them understand that they might be emotionally disturbed about these problems. Certain negative emotions will interfere with problem solving, shift their focus, cause distress, and reduce functioning. Working on these emotions will help them deal with the adversities better. You shall therefore be helping them reduce the emotional distress, help cope with the adversity better, teach them skills to help themselves and others better, improve functioning, and manage symptoms of emotional disturbance. This is how you will not help the patients directly with practical problem solving, but you will help them with the emotional problems first so they can help themselves better. Let's talk about certain specific emotions that you need to work on in a therapy session. Set an emotional or a behavioral goal. For instance, ask for specific feelings that they want to work on. For example, anxiety, depression, anger, or specific behaviors. For instance, not waking up on time or procrastination. Set a goal for an alternative emotional or behavioral reaction. Example, to feel concerned but not anxious, sad and disappointed but not depressed, or to be more proactive, or to stop ruminating, or to stop procrastinating, etc. Here is a list of dysfunctional or unhealthy negative feelings and their corresponding healthy or functional feelings. Anxiety is a dysfunctional and unhealthy negative feeling, and the substitute emotion for anxiety would be concern and not anxious. Similarly, for depression, the healthy or functional feeling is sad but not depressed. For unhealthy anger, it is healthy anger. For guilt, it is responsible but not guilty. For shame, it is disappointed with self but not ashamed. For hurt, it is disappointed at others but not hurt. For hopeless, it is realistically optimistic. For unhealthy jealousy, it is healthy jealousy. And for unhealthy envy, it is healthy envy. It's not difficult to understand what kind of emotions these clients might be going through. Most likely, the most common emotions that you will come across in patients today who are coping with pandemic are anxiety, depression, helplessness, and hopelessness. It is important to agree to reduce or stopping or escalation of certain behaviors as a goal. For example, avoidance would be rather dealt with to increase or decrease that particular behavior, whatever would be helpful. For rumination, it would be helpful to stop or reduce the rumination. Exercise, you have to increase the amount of exercise they are doing. Let us look at what kind of questions you can ask to help you come to a specific goal. Questions like, what would you like to achieve from therapy or counseling can be very helpful in setting the goals for the session. Other questions are, what would you like the outcome of therapy to be? How would it make a difference if you were concerned and not anxious from this point onwards? Here, the therapist has set an alternative emotion, which is concern, from the existing emotion, which is anxiety. Asking the clients that how is it going to make a difference gets them thinking into how a new reaction would be more helpful. Another question like if you could be more proactive from now on and finish tasks even if you don't feel like doing, how would it benefit you? Also can help the client set a specific goal for the session. Remember to set some short-term goals and long-term goals. Set timelines on observable milestones or change in behaviors. If you do not have specific behavioral markers, the progress of the therapy cannot be monitored properly. Make sure that the goals are concrete, measurable, realistic, and largely helpful to the client and significant others in the family or society in general. Check the attached file for a better understanding of dysfunctional and functional emotions and their underlying thoughts.